Hi, I'm Tracey Grainger, Head of Digital Primary Care Development at NHS England. A very warm welcome to this webinar. This is to highlight the new development of a digital primary care maturity assurance model. This has been developed in collaboration across the GPIT community, which was a commitment in the recently published Secure and Excellence in GPIT Services 3rd edition. For the first time, the model will provide a robust and transparent set of indicators that gives a clear indication of the level of digital capability for general practices across England. This will support CCGs with effective commission of GPIT services in executing their delegated responsibilities. The model will also provide insightful information such as provide a baseline of the IT service provision deployed in general practice to understand any gaps in technology capability that could improve efficiency. How well GPIT is being optimised to improve service provision for patients, as well as timely intelligence that will be critical for information development of local digital roadmaps and sustainability transformation plans in helping to identify areas for further investment. I'm sure there'll be many more. In order to help CCGs, as well as their provider organisations, CSUs, understand the tool, we are hosting a series of webinars which will cover the background to the assurance mechanism for primary care, basic functionality of the primary care web tool, and how to access the digital maturity data, as well as going through how we perform searches and drill downs on the system so you can get a level of intelligence that will support you in your commissioning responsibilities. The digital primary care assurance model is in its early stage of concept, so we do recognise further refinements will need to be made and will be grateful for your feedback. Please contact us at england.digitalprimarycare@nhs.net. I hope you enjoy the webinar and thank you for taking time out from your busy schedules to join us. Many thanks.
Introduction, Tracey. Hello, my name is Sue Cook and I'm Program Lead for GPIT in the Digital Primary Care Development Team working at NHS England. As mentioned in her introduction, this is a recording of the webinars that have been taking place during the summer of 2016, which we hope to post as an ongoing resource on the Digital Primary Care website. The purpose of this is to help ensure visibility of this newly launched tool, which will be useful to CCGs, GPs and regional NHS England teams in terms of understanding the digital maturity across primary care. Also on today we have Lee Harrison, who's our GPIT Programme Manager working within the team, and also Alison Tilley, who's our Business Coordinator and supporting the technical side of things for us on the webinar today. If you have any technical issues in viewing this webinar, please contact the Digital Primary Care mailbox, which is england.digitalprimarycare@nhs.net. We have sections within the presentation, each lasting approximately 10 to 15 minutes. If you have any from watching the webinar, then post these via the Digital Primary Care mailbox, and we have details on the final slide. Further general background to the development of the tool. As Tracey mentioned, it was developed in response to requirements of the GPIT operating model. So, a primary care digital maturity index exercise that was undertaken a couple of years ago with stock take of IT equipment than investment of digital maturity. This did identify that we needed to develop a more robust maturity assurance tool for digital primary care. Developed will align very closely with secondary care digital maturity index work that you may also be aware of. As recognized that digital maturity is at a different level of development in primary care to secondary care. While we join the two mechanisms, we've not been able to do that at this point, but we'll continue to work with the secondary care DMI team to align these two mechanisms as soon as possible. You will see as we demonstrate the tool that the indicators have been aligned to the indicator groupings within the secondary care digital maturity index tool, so you will be able to make some clear comparisons. The webinar presented in 4 sections. I'm going to run through a brief introduction and overview, followed by Lee, who's going to run through an understanding of the indicators, also talk you through the data flows, data granularity, and access and sourcing of the data that will be visible to you via the tool. The third is a demonstration of some scenarios within the tool, which we will also present, and a final slide just looking at future plans and next steps, because as you mentioned, this is the first iteration as a tool used across primary care. So, moving on to the tool itself, it's a base tool, rather than focusing on the IT, the boxes wires technology, as with previous primary digital maturity index work. The data provided within the portal developed from existing NHS guidelines for digital technology, which is found within the GPIT methodology document which supports this tool and is available via the tool. Users within the tool were developed initially last June 2015 in collaboration with NHS England national programmes and key stakeholders, including the National Network Quality in Primary Care, the Joint GPIT Committee, in the BMA and other key stakeholders. The initial set was subsequently approved by the Joint GPIT Committee and also the Primary Web Tool Indicator Group in 2015. Into the criteria, a number of key objectives were agreed. Certain of data collection on general practice and CCG should be kept to a minimum. Wherever we would utilise existing data feeds, so data is captured and collected routinely, we will try and build on those data feeds. Where areas should be supported by documented compliance requirements, recommendations and/or guidance, and external categories should be built into the tool wherever possible to increase the usefulness of the data available. It was selected as a platform for this maturity assurance tool. It was developed by the GP community and is already used across general practice, having a well-recognised governance process with enabled validation of the indicators. The Primary Care web tool portal is www.primarycare.nhs.uk. Itself is very much an NHS facing website, so it's only accessible to those with an nhs.net email address. The automated registration and access process. So anyone with an NHS email address will be able to log on to that web address and do the automated registration process. Broad and strategic partners can seek access, which will be considered under existing due diligence arrangements. There are 21,000 plus users of this tool across GPs, CGs and NHS England central and regional teams. There is an email help desk service providing user support and list questions. So we'll offer different groups that we've talked about. So down to CCGs, it will enable you to review progress against core GPIT requirements as outlined in the revised GPIT operating model. Illustrate service quality standards, which is useful for general practice when undertaking reviews such as CQC regulator type reviews. It can also form federations or groups of practices by identifying areas for future investment or creation or support service requirements in relation to digital technology. It could be evidence when applying for additional funds, for example, through the Estates and Technology Transformation Fund. From point of view, again, as I mentioned, it provides that assurance in relation to the operating model, but also the associated GMS, PMS and APMS requirements. It will CCGs when they're going through re-procurement of GPIT services locally, particularly if they're going through the lead provider framework, it will give them insight and intelligence into what service delivery arrangements are provided at the moment, where they're at and where there needs to be targeted improvement with future delivery partners. Can also use to evidence against the CCG improvement and assessment framework reviews. It maps to the digital indicators that are in the recently released CCG improvement and assessment framework. And as Tracey mentioned in your introduction, it will help support the development of local digital roadmaps and also sustainability and transformation plans to identify areas of further investment, but also describing the maturity as it stands at the moment across digital primary care. For NHS England viewpoint in terms of national and regional requirements, it will provide assurance around the quality and value, ensuring that we can demonstrate that's being maintained across the general practice estate, but also demonstrate value for money and the effective use of NHS investment. It will be the quality of GPIT service provision and progress towards digital maturity across that general practice estate. As outcomes-based digital maturity assurance tools that support GPs, CCGs and broad NHS England central and regional teams as promised in the operating model. Thinking through some of the questions that Commissioners will be looking to answer, just running through these on the slide. As I mentioned, can we demonstrate value for money? Can we be assured that services are being delivered in a safe way and a required quality to meet contractual arrangements as outlined in the operating model? Also, about general practice forward view, it will identify progress and some of the areas and the digital ambitions within that, but identify where investment may be needed in the future. Talked about local digital roadmaps and sustainability and transformation plans, opportunities for the CCG to share learning from general practice across the health and care system, which will meet ambitions of the 2020 forward view in terms of the vision, the paper-free at the point of care, 5-year forward, and local CCG strategy. Digital explain the data within the primary care web tool can be viewed in a number of ways. At the number of categories within the system that allow you to drill down in different views. Just to run in a bit more detail as outlined on the slide. First of all, CCG improvement and assessment framework, which is the CCG assessment linked to paper-free at the point of care. The second area is the primary care digital maturity side, which is aligned with the GPIT operating model and outlines the core, enhanced and transformational within the model, within the schedule of services, and will demonstrate progress against those. As I mentioned previously, in relation to the second pair digital maturity index work. In relation to digital technology, so looking at things like summary care record, GP to GP, patient online, you'll be able to go down into this tool to map progress locally. The other category at the moment is around 5 impact changes to digital readiness, which was cited nationally as a means of identifying digital maturity. From a perspective, the key area of interest is likely to be a primary care digital maturity view. As I say, this aligns closely to the operating model and will demonstrate progress. CCG this so that they can demonstrate delivery against core commitments, but it will also support that re-procurement of services as mentioned. Okay, the next slide. Just a bit more insight about the content specific to the revised operating model. You will have seen the recently published Securing Excellence in GPIT Services 2018 operating model. Within this, services are now categorised and defined in 3 ways as consolidated, enhanced and transformational primary care commitments. The consolidated, you can see the definition on the screen. These priorities for CCG's Commission. These are the must-be-done, and it is the enablement of mandated requirements for general, but also beyond general practice, where general practice is an essential component of that mandated solution. Within the teaching model, with core and mandated, there are a few additional requirements, include remote access to the clinical system for care, mobile working, messaging for direct patient care, digital strategy, specialist support for practices, including services around IT and cyber security, but also general practice data quality services, including data quality training, advice and guidance. Moving on to transformational categories outlined on the slide, very much around strategic and tactical solutions. They are discretionary and to be developed and locally in sort of local strategic priorities and commissioning strategies. Aim to improve and underpin service delivery arrangements. These areas should support CCGs in relation to local digital strategy, local digital roadmaps and sustainability and transformation plans. Fund access via a variety of routes to support both enhanced and transformational services in my GPIT revenue and capital routes, but there are also innovation funds around estates, technology transformation fund, maybe part of the local business case with local investment, including direct GP investment. Enhancing much focus on technology, systems and support areas to improve efficiency and effectiveness. This is around supporting primary care at scale, extended hours working and confederated working. Primary care is focused more on the technologies and support and system that will enable new models of care and service integration. Looking to see at the broader multi-specialty community providers and primary and acute care services, it's supporting models where there are health and care initiatives, whole system change. The use of the care maturity assurance module within the tool collects and displays the associated data that will enable GPs and CCGs to review progress against these classification of services and the delivery arrangements involved. Okay, I'll go over to Lee now for the second section.
Thank you, Sue. Second, I'm going to look a bit more deeply at the tool, the data flows, the data granularity, and how we source the data. Bring into a live demonstration of the tool afterwards. Shows the basic outline of the data flows within the tool. We pull in lots of different sources. For the sizing burden for GP practices and CCGs alike, we best source data from existing places as much as we can. The primary source of this is from the Health and Social Care Information Centre, HSCIC. We've tried to pull as many different data flows from this as we can for all national programmes in existence. We've taken cases including the Information Governance Toolkit, Line, Daily Reports, and the GP Utilisation Report. In the public domain and stored in various HSCIC databases. Of course, data directly from general practice. In order to make the burden, we decided to use the electronic declaration that practice managers are already complete on an annual basis. We add additional section into this regarding digital technology and use some of the existing questions and 31 indicators from this. Earlier this year, a CCG questionnaire, which asked a lot of questions about services provided by CCGs for practices in their areas. With 50 indicators from this questionnaire. Okay. Next on the data granularity. We are a lot different between CP level questions and GP indicator level questions. This, which is mainly pulled from the CCG questionnaire, looks at the commissioned by CCGs that cover their entire patch. And here is that there is a comprehensive training and clinical system optimization service to support the principal clinical systems and national clinical services of all practices. This is something that the CCG will provide and therefore will be exactly the same across every GP in its patch. But individual GP level indicators. Example is that the practice is using TP to transfer patient records between practices. This is for each CP surgery, and we use the electronic declaration and various flows from HSCIC to measure this on an individual practice basis. Going to the live demo. So this is the initial first iteration of the module. We're effectively trying to get a baseline of where the digital maturity is across the GPIT landscape. So for this, we very much look at capability, such as does practice offer online appointments, yes or no? Obviously, begin to realise that most practices for this service is very often using the indicator anymore. So start to move more to a utilisation model, such as how many patients are booking appointments online. Viewable by anyone registered on the primary care web tool. There is no permission structure in there. So the reason for this is so that we benchmark across areas. For example, if surgery, university surgery, is benchmark against similar surgeries, it's very difficult to do that in the local area because university surgery tends to have very different demographics, very different turnover to other surgeries. Therefore, the model was able to allow university surgery to across the country a direct comparison. They can benchmark against that surgery on a quarterly basis. This is on the primary care web tool. Though some collections, such as the electronic declaration and the CCP questionnaire, will only be gathered annually, again to reduce burden on CCPs and GPCs. A important point is that the this data is to help guide and inform decision making. It's not a measurement tool, there's a pass-fail or minimum set standard. We have a tool to be able to inform CCPs, surgeries, and then England of GPIT estate, and therefore be able to inform and guide. Okay, registration. The web address is www.primecare.hs.uk. Okay. Clicking on that, the home page, account, you can come register, and it will be automated register screen. Here you can basic details, and you'll be sent a link automatically. It's on a net account if you are a stakeholder, but it will still access. Click on the contact us and follow links to send out to the primary care web tool team, and will be assessed on a case-by-case basis. Okay. Our tool. Under the primary care web tool, will have seen this screen before. When you are taken to medical, dental, pharmacy, optometry, at the moment there are only modules available in medical. You will notice what has appeared at the bottom, and I did the maturity index. This will do the map view. Now, this is a view that is used for primary care web tool, and it's again used here under the module. Before I go to the data, obviously in this webinar, we cannot cover everything. We try our best, but there is action available. And more about how we calculated our numbers, our entire list of indicators, resources, and down to GPIT methodology here. That format. That view, here we see the overall compliance voluntary. This review is done. Any of the individual areas will change that for a comparison. Is being used by clicking on the drop-down menu here in different ways. A set of indicators just cut in different ways depending on how useful it is to data. So we have national programs, and here we have the granularity. This is a very important view because, as mentioned before, this shows the difference between CCG data and data. So you can start to look at what's expected in the CCG and what is happening per GP surgery. Going back to the view, more enhanced and transition, as you mentioned earlier, we can down into level. Here's that region, by areas, you can see the next comparator for the regions. Clicking on will bring to the CCG level view. This is Google Maps and the CCG area highlighted. From here to see the first time that the data quality score is next to the compliance score. I will go into a little more detail about the difference between data quality and compliance. To an individual CCG, it brings up the map and marking every individual surgery within that CCG. The code is bottom focus, the light 75 to 100%, and as the blue tab, it shows lower compliance with the indicators. So seeing overall compliance, and any of the surgeries are light blue. Here we can find different options to show different views. So clicking on Enhanced Primary Care will show that, obviously expected, there is less compliance with Enhanced, as is expected. As the firm gets away from core and more enhanced and transformational, we expect less surgery to be fully compliant. Keep on compare compliance to show this will get the CCG with CCG in the DCG. Again, change the mix between maturity, national program, data granularity, or any other cuts, and submenu, enhanced, etc. Printed off or downloaded used in reports. If shown, can be downloaded into Excel formats by clicking on Download this data. You can group data to show it in different forms. Clicking on the practice will show every individual surgery in the area. And again, value and data. Between these two is one engagement. That every surgery wouldn't be able to gather every piece of data. Obviously, taking 107 different indicators from various streams, hoping that this will also help highlight where there is gaps in data. So, in practice down where there is no data, in order to split it out into two separate categories. Is out of any indicator we've been able to gather, this is the data is 107 indicators that the percent able to gather for each surgery. Also, we've seen at practice level. For the purpose, I will go back into the PowerPoint. While it is public domain data, we have not asked any particular surgery to show their data. So we've concocted some dummy data to show the practice use. Okay, tracking looks exactly like the CCG with one slight exception. Half view, clicking any of these buttons will bring up the list of indicators. So for all compliance, we'll bring up a list of every indicator and give them the non-compliance, or a value of 0 for non-compliance, 1 applicable for partially compliant, or 2 for full compliance. And this is calculated the percentage score. Just like this drop-down view can be used to show different cuts of the data and narrow down to different indicators. And similarly, there is also a graph view which compares to other practices in that. And again, with a CCP level view, practice can be downloaded and compared against other practices into an Excel format so that you can do your own analysis. The top tour of the tool. Tracey mentioned at the beginning, this is very much the first iteration, and if you're on the tool, if you see any issues or have any feedback, please do not hesitate to contact us. All of our contact details are at the end of the webinar. I will now Sue for section 4, future plans.
Thanks, Lee. As Tracey mentioned at the start of this webinar, we are keen to build on this initial tool indicator set, very much realising that we are in the early stages of development. We need to ensure that this tool continues to remain a dynamic and supportive tool for CCG, general practice, and also NHS England regional central teams, as we move towards paper-free at the point of care digital ambitions. So we've just tried to identify some of the areas and development opportunities that we'll be exploring in the coming months. So through these, the next few months, continue with training and ensuring that commissioners have full visibility of the tool and how to optimise use of the tool, particularly when we're procuring services, as we mentioned earlier. As we are very keen to link or integrate with the Care Digital Maturity Index work to build that broader community picture to help support local digital roadmaps and also sustainability and transformation plans. As confidence around the core ability, the emphasis will shift, as Lee has mentioned, much more to enhance and transformational enablers, and also from capabilities to utilisation and consumption focus. This is great progress as we move forward in terms of that digital maturity assurance. Data from existing routine data feeds, and we are exploring how we can capture utilisation data much more seamlessly, rather than having to request that data directly from either general practice or via CCG. Key component of a future digital primary care operating model or framework and strategy will be about providing this central assurance and supporting local autonomy and linking to innovation, and being able to assure against the incentives and levers that exist within the system. And this is developed to support all of those areas. We've got to reflect new models of care and that wider primary care view. Going forward, we hope that the tool will effectively support the GP forward view and the digital ambitions that are outlined within that. Thoughts regarding future development and or use of the tools, then please do get in touch with us via the digital primary care mailbox. Equally, like to support developments as we move forward and perhaps operate as one of our pilot sites when we are introducing changes, then get in touch with us as well. We're always keen to work with general practice and or CCGs, ensure that whatever we develop is fit for purpose and meets your requirements. Details are available on this final slide. Thanks for the time to listen to this webinar that we've recorded as part of a suite of support resources that are available on the Digital Primary Care website. I hope this has proved helpful for you. If you've got colleagues who you think may benefit from hearing this, then please highlight this resource to them. And for any specific query or questions, I should forward these to the digital primary care mailbox in the first instance, as this is routinely monitored, and we'll ensure that your query is passed on to the most appropriate person. Also included on here, contact details for myself, Lee, and also Joe Gander within the digital primary care team to have specific queries that you want to direct to us. Thank you for your time today, and I hope to agree with you.